is after about 2 weeks. Therefore, you lose significant opportunity of 14 days where you could be able to trace, isolate, and quarantine people, and therefore stop further transmission of the infection. So that is one big limitation of the rapid test kits. Number two, the rapid test kits are not selective. There are very many groups of, very many types of coronaviruses. So even if you have the coronavirus that causes a mild cold, the rapid kit could interpret it as COVID-19. That is what we call in science a false positive. And therefore, you will be diagnosed as coronavirus disease 19 positive, yet you have the simple corona that causes a cold. Number three is that if you are immunosuppressed, like if you have HIV infection, or you are malnourished, or you have a serious infection like TB, your immune response is subdued, and therefore you tend to produce less antibodies or no antibodies at all. In that case, if you put you through that test, it will come out negative, yet you could be positive for COVID-19. And finally, regarding the rapid test kit, is because even if you have the antibodies, evidence has not shown that those antibodies will protect you from reinfection. However, these are good diagnostic equipment that can be used for research purposes, like in Cambridge, and also for carrying out what we call seroprevalence surveys, or you want to find out the spread or the incidence of a disease in a community, or the prevalence of a disease in a big community. I also wanted to emphasize a bit on the cases from Kawangware, as Madam CS has alluded to. There are 20 cases from Kawangware. 12 of these cases can be traced back to one single individual. And this single individual used to work with us at the Emergency Operations Center. This single individual passed the infection over to 6 primary contacts. Out of these primary contacts, there are 5 secondary contacts. So if you draw that tree, there are 12 people linked to this particular case. If you look at the case of Kilifi, the index case had 5 primary contacts, 1 secondary contact, and 1 tertiary contact. And of course, we continue to do surveillance because the 14 days mandatory period for incubation has already passed. So you cannot be able to tell how many people one person can be able to pass the infection to. And why am I saying this? Because this is important, because then it is the reason that we talk about quarantine and isolation. That quickly, if we test you, we need to move you into the isolation unit so that you don't stop growing these branches. And for those who test positive, of course, we also move you to the isolation site. The others who have not been tested, of course, are kept in quarantine, therefore trying to stop the transmission. And that is basically what leads to a flattening of the curve. Finally, I wanted to share with you the donation that we received from one of our many partners who have supported the ministry. One is the Jack Ma Foundation. I have a table here with me regarding the quantities of whatever was donated, what has been distributed, and what is still in stock in our Kempster stores. Like, for example, the test kits were a total of 208. If you multiply that by 80, you get about 17,000 test kits. Remember, if you test you and you test positive, at a minimum, you will require 3 tests at a minimum. The first test, the index test, that determines whether you are positive or negative. If you are positive, then you require another second test after 14 days. If that test is negative, you require another test after 24 to 48 hours. So if you divide this number of kits by 3 on average, then you find that we had about 5,000 to 6,000 test kits. And therefore, anytime we report that we have a given number of test kits. Remember, each individual at a minimum will require 3 tests. So always divide it by a minimum of 3. Of course, we also received viral transport media, 18,900 pieces, all which have gone to various laboratories, various face masks which have all been distributed, medical disposable protective clothing, 1,100 pieces distributed. I can be able to share this with you. So in a nutshell, based on what I've been able to share with you, is that we are not out of the woods yet. We expect a surge in our numbers as we continue with the targeted testing. And therefore, it means we require more quarantine facility. And that is why Madam CAS has clearly articulated that we need to look at our quarantine policy, because the numbers soon will be huge, and possibly look at even home-based care. Thank you.
Yeah, just questions.
But the same government is now telling people, particularly in Kawangware and the areas where mass testing is actually being conducted, to actually turn out in large numbers. This is a process that is actually being done in an open air place. And I was in Kawangware where some of your awareness people telling the Kenyans that, okay, this virus stays in the air for about 3 hours. So if at all you cough and it finds you maybe in such kind of a scenario, you're likely to get infected. Some people are actually traveling all the way from Kasarani pipeline to go to Kawangware for the mass testing. How secure are people who are undergoing for this mass testing?
And still on Kawangware, the Interior Principal Secretary, Dr. Karanja Kibicho, had mentioned that mapping out was being done of estates that have seen an exponential rise in the number of infections, and they would be mapped out for more stringent measures, including possible lockdown. Maybe, has this been considered for even an area like Kawangware, which is a densely populated area, including Isli? And maybe you can also touch on the fact that we've seen, since the mass testing began in Kibokoni and even Old Town Mombasa and even parts of Nairobi, initially there seemed to be low people turning up. Maybe there's the stigma associated with COVID-19 and even the possibility that one will fear being put in quarantine and cater for that particular cause. So maybe what is being done to ensure members of the public see this as an initiative that will help the country and maybe turn up for testing.
My name is... there are rising cases we've seen the rising cases of coronavirus in Tanzania. Is this a concern now to Kenya? Because we've seen our neighbors, Uganda, have recently reacted towards their response. And has the Kenyan government now been in communication with the Tanzanian government regarding the matter? My second question is regarding the 51-year-old lady who passed on in Mombasa. So our sources tell us that the lady was an employee of Central Bank in Mombasa, and her children are right now in quarantine. Could this mean that this is a threat for everyone who works at the Central Bank in Mombasa? And my third question to you is, are the cartels in the ministry fighting or hindering the fight against the pandemic against corona as well?
Purity Musa from KBC. You talked, the DG, you talked about a new drug which has been approved in the U.S. We do understand that U.S. has the highest number of coronavirus cases in the world and also deaths. Is there proof that the recoveries that were confirmed in the U.S. were as a result of the administration of the drug, or it could be it was just immunity, the immunity that was high? And then to the CAS, when you talk about some people being picked by the surveillance team, what exactly do you mean? Do they randomly walk and test people on the streets, or being picked by surveillance team? Because when you've been making the updates, some numbers you say that they are picked from by surveillance team. Probably you can expound on that.
Okay, thank you. Thank you for those questions. I think I'll start with Purity's question on surveillance, there is actually a scientific methodology that is employed when you're doing contact tracing. Yesterday, the Cabinet Secretary was able to share with you in one of the slide presentations what contact tracing would look like. Hypothetically, say you have case number 2 and that you've confirmed that case number 2 is positive. There's actually a mechanism that we deploy where case number 2 undergoes a history-taking procedure, and we're able to map out the patterns of movement and contacts of case number 2. When that history is taken, this is uploaded on a database, and then the cases and a branch, diagram is drawn, and the next primary contacts of this case are then investigated. And this goes on and on and on until you're able to pull in the contacts, the primary contacts of this case, and you're able to test them and confirm them. If you remember when the DG was expounding on some of the models that we were discussing much earlier, some of the assumptions that actually go into the modeling are pegged on how you do your contact tracing. And so it's actually a methodology that is done. We're not simply running around and picking people on the street. There's actually a science behind how that is done. With regard to the question from Chemutai on mapping out of estates, again, yesterday and even in previous briefings, we've been able to share with you areas that we consider to be hotspots and clusters. And again, this is information that is generated from our contact tracing and from our surveillance activities. And indeed, you've seen the world over, different countries have gone on and employed different methods. Some have gone on to impose partial or full lockdowns in different hotspots. This is an issue that will be under discussion tomorrow in the NERC, and we shall be able to relay with you the following interventions after that discussion tomorrow. Again, there's a question with regard to stigma. I think last week we highlighted it, and we've received lots of calls and messages from Wananchi trying to, share their experiences in terms of stigma. I think we shared with you our case of an ICU recovery case who has actually struggled to be assimilated back into the community. We are looking at revamping our communications, looking to have champions, people who've recovered from corona, who can actually share their message and their experience and tell us that this is something that we are actually able to combat. But that being said, we are looking at adding more approaches, trying to see how we can actually incentivize Kenyans to come forward. Tomorrow again at the NERC, we'll look and see, are there measures we can put in place to encourage people to come and test? Are there measures we can put in place to ensure that quarantine perhaps is not at a high cost to Mwananchi? And so all this will be discussed tomorrow and shared with you after the NERC meeting tomorrow. There's a question from Kaemba with regard to returning back to business. And people perhaps, it's looking like it's a paradox when it comes to the containment measures. I think several times we reiterated and said that even as we, for example, reopen hotels, containment measures must be put in place. As people go to the barbers, you must ensure that you're masked. As you go back to work, you must ensure that your surfaces are sanitized. And this is essentially what we are saying, especially in light and in view that coronavirus might be here with us for a long time. Like I've said, this is not a sprint. This is a marathon. And therefore, balancing the merits of ensuring that we put in place containment measures that protect us and ensure an element of economic continuity, it's important then that Kenyans work with us. Like I mentioned, we've been doing random checks. I myself was in Kawangware just the other day, and I could see people with masks, but the masks are hanging by their noses. I could see sanitizer, but sanitizer did not look like it was being utilized. The bottle was quite full, and people were just passing around it. And what we're saying is, if Kenyans can work hand in hand with us, of course we want to go back to normal. Of course we want the economy reignited. But we have to also protect the countrymen, and this therefore means we have to work together and enforce these containment measures while trying to come to a new normal. There's a question concerning Tanzania and the rising cases, and I think this has even been highlighted in our brief today. One of our cases today is actually a contact who had come in traveling from Tanzania. And as you all know, Kenya is part of the East African community, and therefore there are discussions with our different member states to be able to come up with mechanisms that actually enforce good screening procedures at the border. And yesterday, the CS was able to highlight some of these measures. Discussions have been held, and agreements have been made in terms of how we can ensure cross-border travel is going on in a manner where screening is effected, and we're actually ensuring we're protecting EAC as a community. There's been a question again regarding our case, the lady who passed on. I hesitate to provide details because, again, you must remember, this is still a medical case and we are confined in terms of disclosing details of this particular patient. However, what we are saying, if you can all actually tabulate up to our case today, our caseload being, more than 400 today, all these are people, most of them who've had contact, other than our imported cases, who've been in the community. So narrowing this down to central bank is actually quite misguided on our part. These are Kenyans who've been in different areas in the community, in supermarkets, perhaps even brushed across you as you're walking in the street. The idea here is, and the resounding message here is containment and adherence to social distancing measures. Perhaps the last question before I hand over back to the DG, just to emphasize on contact tracing, because I think clarity is required, more clarity is required there. There's a question on cartels in Afya House hampering the fight for coronavirus. This is an issue that our cabinet secretary has clearly elaborated on, and he continues to be a steward within the ministry, ensuring that he actually ensures that there's accountability and efficiency as we deploy resources towards coronavirus, but also resources for many other interventions. Remember, this is not a ministry of coronavirus. This is actually the Ministry of Health, and there are many other diseases and conditions that we deal with. And therefore, the CES and his team, his leadership team, are ensuring that there's efficiency in deployment of all resources. Bwana DG, perhaps highlight further what it means to actually do contact tracing and the issue of Kawangware.
Thank you, Madam CS. I think she has articulated very well the science of contact tracing, and that is how we are able to build this tree of Kawangware and Kilifi. And based on that, of course, the subsequent measures that we take, including the quarantine and, of course, the positive cases, moving to the isolation centers. But together with that, of course, we will not tire from reminding you of the infection prevention control measures, including the hand washing, the use of the sanitizers, the physical and social distancing, and of course, proper use of masks. And I want to support Madam CAS. Kenyans now have this tendency of wearing their masks on their chin. I don't know why then. Why would you put it on your chin? I would rather, if you don't want to wear it, then don't wear it, so that then the security guys can be able to deal with you. Because you put it on your chin, then you put it back on your face, you contaminate yourself, and you put yourself at a greater risk of contracting the disease. Regarding the trial in the US, this was what we call a randomized controlled trial, where you have one arm of people receiving a particular treatment, in this case, this particular medicine, remdesivir, and the other arm would receive the normal treatment. And the first primary endpoint was either stoppage of use of supplemental oxygen or discharge at home. And that was clearly elucidated by 31% of the people who are receiving the drug, either stopping use of oxygen early by day 11 or them being discharged by day 11. The secondary endpoint for this study was, of course, mortality, and that data is being analyzed. So I cannot clearly state before you today that remdesivir actually decreases mortality or deaths. And that is why I said in my statement that it is not a silver bullet. Let me also just highlight something small regarding the hotels. When we said that the hotels open, we developed clear policies, guidelines, and protocols to be used. And when we opened hotels and restaurants, we didn't blow the whistle for people to now go and congregate in hotels and restaurants to go and partake their meals. Instead, we really want the hotels and restaurants still to focus more on takeaways. And this is because as we are going to open the hotels, we are also going to talk of this testing, which will include a financial cost. And because our guidelines clearly indicate that primarily if before you had, for example, like 40, you could seat 40 people at full capacity. In the revised guidelines, you could be able to seat just about 8 to 10 people. So it means you'll have also to reduce your staff numbers. And therefore, if you reduce your staff numbers, it makes business sense to focus more on take away than people seated there to be served. We are going to do random inspection to ensure that all hotels and restaurants apply to the letter the guidelines and protocols that we have developed. And if you are found flouting any of these guidelines and protocols, one penalty, of course, will be closure. Then the secondary penalty, of course, will be prosecution under the Public Health Act, Cap 242. If we continue with our journey the way we have journeyed this far, and following our presentation yesterday, we could be able to flatten the curve. If you looked at one of the slides was presented yesterday. However, if we think that things are okay and we are back to normal, the Republic of Ghana today, after removal of the lockdown, has noticed a more than 40% upswing in number of cases. And we are not immune to that. Thank you.
I think.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
When it comes to pimple care, Acne's Creamy Wash contains multiple vitamins and removes excessive oil and dirt. Acne's Toner rejuvenates skin. Acne's Sealing Gel fights bacteria. Use Mentholatum Acne's for clear and smooth skin every day.
Look at gesturing. It is on the same point of affirming. But in this case, on gesturing, this is where as a teacher, you are working.
The second reason why entrepreneurship is important is also that it helps you to plan for business finance. Business finance here simply means how much money do you need at the point of starting the business, and when is it needed, and is it for a short period of time or for a long period of time?
We still feel that the tourists are not getting value for their money. That experiential experience they are looking for is not there.
The coronavirus has negatively affected the business environment not only in Kenya but also globally. We at TV47 are in support of measures taken by the government of Kenya to safeguard the public and keep livelihoods going. In this regard, we wish to appreciate the business entities that are resilient and putting on the Kenyan spirit to sustain their businesses. We wish to support your business and the measures taken to be at the forefront of championing COVID-19 awareness by giving you free advertising in our 24-hour nationwide TV station. You can advertise your business and mention measures your company is taking to mitigate the spread of the virus. This initiative is geared towards providing a platform for continuous interaction with your clients and visibility of your business. To be eligible for this free advertising on TV47, please visit www.tv47.co.ke/advertiser and fill the following details. For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Na msafi kabisa mpenzi mtazamaji, karibu kwenye shina la upeo. Mimi ni mtangazaji wako Paul Kirobi. Sasa hivi ni saa 10 kamili saa za Afrika Mashariki. Hapa katika taifa la Kenya tunasema ni alasiri. Naam, watu 24 zaidi wameripotiwa kuwa na virusi vya corona. Kumbuka hii ni idadi ya juu zaidi ambayo imeripotiwa siku ya leo, na kati ya watu hao 24 kwamba 10 ni wanaume na 14 ni wanawake. Watano kati ya 24 hao wametoka katika kaunti ya Mombasa. Visa 7 ni kutoka katika eneo la Kawangware, 10 kutoka katika eneo la Isli, na mtu mmoja zaidi kutoka Mombasa ameaga dunia. Idadi ya waliaga sasa imefikia watu 22, na idadi ya visa vyote vya corona imefikia 435 watu ambao wameambukizwa na virusi vya corona, na watu 2 zaidi wamepona virusi vya corona. Idadi ya waliopona sasa ikifika 152. Hayo taarifa hiyo mtazamaji tutakuandalia hapo mida za baadaye. Kwingineko ni kwamba huku janga la virusi vya corona likiendelea kuzua tumbo jote kote ulimwenguni, wazee na wabugumbe katika eneo la Kuria kaunti ya Migori waliandaa maombi maalum kama njia moja ya kumwomba Mungu ili kuwafukuzia virusi hivyo vya corona nchini. Wazee hao wanaamini kuwa kupitia maombi wataweza kufukuza virusi hivyo na kukomesha kusambaa kwa virusi vya corona, na bali na kufuata vigezo vyovyote vya serikali kama kutengana umbali wa mita 1, kuvaa barakoa na kuosha mikono mara kwa mara.
Kugusana na corona. Corona ni ugonjwa ni ile tulikuwa hatuyaona hapa. Imerudisha watu nyuma, hata biashara. Corona, tunaomba Mungu wetu kutoka juu. Mungu wetu ndio atatusaidia. Hii maneno ya corona irudi ende. Magonjwa ilikuwa inakuja hapa mengi tangu zamani, lakini hiyo tulirudisha ikaenda nyuma. Sasa vile tunarudisha na hii, tunaomba Mungu wetu kwenye mlima wetu hii ya Renjo Karebwiri kuwa urudisha hii kitu, wakuu wetu watusaidie hii, wale wasee wa zamani, wale wakuu wa hii mlima, utoke kichwa chenu iche, itusaidie watoto wetu.
So as a community, we are sure that what they have done here today is an indicator towards the participation in this war. And we have sought the elders' efforts in ensuring that we also join our force in fighting the coronavirus. And we are very sure that the coronavirus will not affect any person within the boundaries of Bugumbe.
Na tukiachana hayo, kwingineko ni kwamba familia moja kutoka kijiji cha Nambengele, wadi ya Bunyala Kaskazini, inaomboleza kifo cha mpendo wao wa kiume mwenye umri wa miaka 24 aliaga dunia akiwa katika shughuli za kuokoa waathiriwa wa mafuriko maeneo ya Busagwa. Hii ni baada ya mtonzoia kuvunja kingo zake kwenye tuta la kusini mwa mto huo wadi ya Bunyala jana jioni. Kwa mujibu wa naibu chifu wa kata ndogo ya Ruambo wadi ya Bunyala Kaskazini, Augustine Swati, alipokea habari za kifo cha mvulana huyo ambaye alikuwa mwanafunzi kwenye chuo cha Anuai cha mafunzo cha Anuai Technical Vocational Training Institute katika lugha ya King'eng'e.
Na kama kitu ya saa 12:30 saa 1 kasorobo ya usiku nilipigiwa simu na jamaa mmoja ya kwamba alikuwa amemchukua hapa kijana ambaye anaitwa Alvin Bwire mwenye umri wa kati ya miaka 23 na 24 hivi, wakaenda kuweli kuweza kuokoa watu upande wa Busagwa kuliko mafuriko kule. So alinielezea kwamba walipomaliza kubeba mizigo pande ile kuanza safari ya kurudi, walikuwa na pick up, wakaona maji mengi yakija upande ambapo walikuwa. Kijana akaona afadhali aruke kwa gari atembee kando ahepe yale maji, lakini alikuwa kwa speed ya hali ya juu, yakamgonga akaanguka katika mtaro wa irrigation na akaenda naye.
Naam, tukivuka hadi katika maeneo ya Webuye ni kwamba familia kadhaa katika wadi ya Sitiho, eneo bunge la Webuye Magharibi, zimeachwa bila makao baada ya mto Nzoia kuvunja kingo zake kufuatia mvua kubwa inayoendelea kunyesha na kupelekea nyumba zao kuanguka pamoja na kuharibu mimea yao. Wakazi hao wanasema kuwa wanapitia hali ngumu tangu mvua ianze kunyesha mwezi jana, huku wengi wao wakikosa pa kulala.
Vile mvua ilinyesha karibu nyumba yangu inazama.
Nimeshangaa sana wakati nimetoka asubuhi kuelekea kule upande wa Milo, kuelekea kule ndani ukaaji wetu kule, na nikaona watu wengi wamelala nje, wameloa na maji. Sasa nashangaa tutakuwa nakumbwa na mkasa wa corona ama tunakumbana mambo ya mvua ya kunyesha.
Mvua ilianza ile ilinyesha sana. Niliona tu maji inaanza kutoka kwa nyumba, kutokea chini. Nyumba tu yote. Hata mwisho niliona tu kitanda imekwama.
Ilikuwa jana saa 3. Alafu nyumba yangu ikapomoka. Nikaanza kuchota maji nyumba yote. Nikaanza kuchota maji na kumwaka nje, kuchota maji, nilichota maji mpaka saa 10. Na nikasimama tu na watoto yangu, sikulala. Kwa maana nilikuwa hakuna pali ya kulala. Nyumba ilikuwa tu maji.
Na kwa hizo familia 48, kila nyumba yuko na watoto karibu watoto 8, watoto 11 na mama na baba. Na sasa kwa hivi hawana makao. Naomba mtu yoyote mwenye ana uwezo wa kusaidia, hata kama ni mabati moja, hata kama ni blanketi ama hata ni chakula, aweze kusaidia watu wangu wa Sitiho wote.
Naam, kwingineko ni kwamba familia zilizoathirika na mafuriko katika maeneo mbalimbali ya kaunti ndogo ya Teso Kusini, kaunti ya Busia, zimepokea msaada wa chakula kutoka kwa serikali ya kitaifa. Kwa mujibu wa naibu kamishna wa kaunti hiyo ndogo, Willy Cheboi, familia 400 kutoka eneo la Aremit na Asinge zimenufaika na msaada huo unaojumuisha mchele pamoja na mafuta ya kupika.
Tusumbua sana ni maji. Maji ni afurika paka daraja ya kuenda Malaba Machakusi, kuenda Busha, na huko ndani yote manyumba zimefurika maji yote saa hii. Hakuna vile yoyote mtu anaweza kusaidika huko chini. Tumeteseka huko. Kama serikali inaweza kutusaidia, afanye nini? Atuweze kukinga hiyo vile maji hiyo iwezi kutoka ndani ya mto. Enyewe tunateseka saa hii zaidi.
Kusaidia sisi kwa upande ya kuzuia maji, na upande ya maji tunaweza kufaidika kwa upande ya chakula, tupate mavuno fulani. Eleza ya kwamba wasirudi kwa maji, wa move to safe ground mpaka wakati ile maji ya mafuriko itakuwa imepungua ndio waweze kurudi makwao. Vile vile tunahimiza watu ya kwamba wakati ya coronavirus wazingatie zile sheria ilitolewa na Wizara ya Afya kuhusu corona. Hapo kama serikali anaweza kusaidia sisi kwa upande ya kuzuia maji, na upande ya maji tunaweza kufaidika kwa upande ya chakula, tupate mavuno fulani.
Na tukiachana hayo na kuvuka katika kaunti ya Mombasa, ni kwamba licha ya serikali ya Mombasa kuruhusu vipimo kwa umma, bado wenyeji wa Mombasa wanaendelea kukaidi agizo hilo, ni kiwango cha wanaojitokeza kupimwa kikiwa cha chini mno, jambo ambalo limeonekana kumghadhabisha gavana wa kaunti ya Mombasa Ali Hassan Joho. Katika hotuba yake kwa wakazi wa kaunti, Joho ameomba wananchi kujitokeza na kupimwa virusi hivyo vya corona.
Twazipenda just like you love your family. Lakini tunajichunga kwa sasa. Kila mtu afungua maadhini kivyake, na lau kama tuko nyumbani tuwakaa na watu ambao hawatoki ndani ya nyumba, kwa sababu usijiona una nguvu sana. Corona iko namna hii. Kuna watu wako na symptomatic na wengine ni asymptomatic, huwezi kuiona. Strong na akikohoa, akikuzungumzia chini ya mita 1 amekuachia corona. Wewe na ubabe wako utoke umfate mamako nyumbani antulia na saumu, yomba Mwenyezi Mungu wake umpelekee corona. Kuna nchi watu watamani kupimwa. Watu wanatoa mapesa kupimwa. Wewe umeletewa vipimo, leo tuko Tijara hapo, nimeuliza paka saa hii wameanza saa 2 usubuhi watu 7 people.
11 wameweza kufariki na corona. Watu 6 wanatoka katika eneo la Old Town. Lazima tukubali, tukiwa kweli ni wenye kuamini dini, ikiwa kweli tunaamini, lazima tuwe wenye kukubali ya kuwa things cannot be the way they are. Hatuwezi kuendelea vile vile tulivyokuwa tukiendelea. Hakuna ambaye kwamba alikuwa akizunguka nje kufungua muadhini kila siku kama mimi na gavana wenu. Kila siku tuaenda katika kila sehemu. Leo kwa kuwajali nyinyi na kuhakikisha ya kuwa nyinyi mujali wengine, tunawaambia ya kuwa kaeni katika majumba yenu.
Na ni hapa ndio mahali imebakia. Na hapa sisi tutawekea uzito wote. Old Town. Tafadhali tufuata hayo maagizo. Na vile mheshimiwa gavana amesema, tutamonitor siku 2-3. Kama wale wanakuja mass testing bado ni wachache, sisi tutafunga Old Town. Mutabakia pale ndani na kuwalazimisha mfanye mass testing mkiwa pale ndani, kwa sababu kuna baadhi ya watu pale ambao hawajali.
Na mtazamaji, bila shaka kumbuka kaunti ya Mombasa ndio kaunti ambayo kwa sasa inatupiwa jicho zaidi kufuatia maambukizi ya virusi vya corona. Kwingineko ni kwamba kampuni ya Kakuzi imeweka hatua za kuwapa wafanyakazi wao mazingira mazuri ya kufanyia kazi, huku wakifuata hatua zilizowekwa na serikali kudhibiti kusambaa kwa virusi vya corona. Vile vile kampuni hii imewapa wafanyakazi hao makazi na hata chakula, huku taifa likiendelea kukabiliana na janga la corona.
Tunapima wagonjwa wetu kila asubuhi, wafanyikazi wetu kila asubuhi, tuhakikishe hana hii ugonjwa wa coronavirus. Then tunahakikisha wamevalia the masks in the right way, the social distancing wanaweka wakati wa kuharvest, kila mtu tunamweka kwa line yake, na tunahakikisha wana utilize the mask in the right way.
Mimi nimefurahi pamoja na watu wa hapa Makuyu kwa vile Kakuzi imetusaidia na tagi ya maji na sabuni. Kila wakati tunafanya biashara, tunaenda pale tunaoga, customer wangu wanachukua miwa, wanaenda wanaosha pale, wanakula kitu safi.
Na tukirejea hapa jijini Nairobi ni kwamba taifa linapoendelea kukabiliana na janga la virusi vya corona, mitaa mbalimbali hapa jijini Nairobi imeweka mikakati tofauti katika kukabiliana na corona. Wakazi katika mtaa wa Nyayo wameanzisha mchakato wa kunyunyizia sehemu zilizo na watu wengi. Mchakato huu utaendelea hadi wakati ambapo virusi vya corona vitakapokamilika. Wakazi wa mitaa hiyo vilevile wameshirikiana na hospitali ya kifamilia ya Ruai ili kuwakagua wakazi wa maeneo hayo.
Every entry from the main gate, and then at the entrance of every block we are a court that houses 80 houses, and so we have 10 blocks. Per block there is a washing point, and to just as an addition of the washing points, the men of the court came together and organized themselves under the training of Ministry of Health. We disinfect our court, the open spaces, the stairs, and outside the parking lots. We disinfect every Saturday from 9. And so currently, our disinfection is ongoing.
Today, from the press briefing by the Ministry of Health, we received that we've got 3 cases. As Nyayo, I want to assure my residents we've made so much progress in terms of our containment of COVID. We've got sanitization booths in every single entry and exit in the estate. We've got hand washing stations in every single court and maisonette zone. We've got, we do screening of every entrance by either pedestrian or by any vehicle. That's a standard procedure. We've maintained social distance protocols as advised by the Ministry of Health.
Na kufikia hapo mpenzi mtazamaji, mimi natia kikomo kwenye shina la upeo, lakini kwa taarifa zaidi nitakapotimu mwendo wa saa 1 kamili kwenye upeo wa TV47. Nimekuwa mtangazaji wako Paul Kirobi na kutakia jioni njema.